Premature and critically ill newborn babies may need surgery soon after birth to address congenital defects, abnormalities, or because of problems with prematurity. So how well do babies tolerate surgery? How often is it needed? And what about recovery? Stand by, Go Healthy for Good starts right now. Hello and welcome to Go Healthy for Good. Meet Wendy. Here's her story.
I grew up moving around a bit. It was just a normal upbringing. In those days, there was no real conscious thing on healthy food and that. It wasn't as well known, I suppose, as now. And it's sort of, you brought up with everyone meat, 3 veg, and that was your dinner, and that was the way it was. And it's just evolved from there, basically. I didn't have too bad a diet in a way, but it was what everyone else was having. It wasn't until I got married, my husband was quite active. Matter of fact, fanatically so. And he got me into a lot of things, like we played squash and did a lot of things like that, and was always away camping and out in the outdoors with the kids. And it wasn't until I sort of started to get symptoms of MS that things started to change. First symptoms of MS was back in about 1989, and it was just the left side I lost. Didn't have it. Apparently it's the same symptoms as a stroke, that you get this weakness down the left side, and it was only dragging the feet. It was just this, I found that I was walking funny. You could hear me, the slapping of the left foot. So, and it just went on from there. I just knew there was something wrong because I couldn't walk for any great distance without getting this, losing balance. And it took from then till 2000 to get diagnosed, because when you go to someone that you've got a problem like that for, the doctors, they start with the bottom of the spine and work their way up, and my demyelination's in the brain, so it took till then to find out exactly what was going on. I mean, there's different degrees of MS. There's a lot of different symptoms, and I've only had you still get things like short-term memory loss and, like bodily functions that's starting to change. And there's just a lot of little things that you just cope with as they happen.
What a great attitude. More from Wendy later in the show. We'll learn about problems that require surgery in the newborn period and drop into the kitchen for a rather special treat from Melinda. So let's get the ball rolling with the news. In the headlines, exercise helps ADHD, night owls are less active, and home gardens are good for kids. Previous studies have shown that exercise enhances brain power and executive function in the general population. Now a new study shows that exercise interventions can improve overall executive function in children and adolescents affected by ADHD. Researchers combined the findings of 15 studies involving almost 500 kids looking at executive function and found a moderate to large positive effect on inhibitory control and cognitive flexibility, and a minimal to moderate effect on working memory. Repeat episodes of moderate rather than light or vigorous intensity exercise was most effective. Compared to other studies in young adults, it's possible that more benefit can be gained by introducing exercise in childhood during the formative years. So if you have a child or grandchild affected by ADHD, encourage regular, moderate intensity physical activity so they can achieve optimal cognitive development. Night owls exercise 56% less than early birds, according to a UK study involving more than 600 people with type 2 diabetes. Participants wore tracking devices for a week to record intensity and timing of their physical activity, their sleep, their rest, and sedentary time. 25% were early to bed and early to rise, 23% late to bed and late to rise, and 52% were in the middle. The early risers did more intense exercise for longer and were less sedentary than the late risers. So if you have type 2 diabetes, revise your schedule and become a lark. Walk off those blood sugars. Home gardens may help address malnutrition in kids in low and middle income countries. A pilot study in Guatemala involved children who were stunted and living in poverty. 70 families were given the standard care package of food supplementation, multi-nutrient powders, monthly nutrition home visits, and group nutrition classes. 70 other families also received the standard care package, plus a home garden intervention, including garden materials, monthly agricultural home visits, and agricultural classes. After 6 months, the garden group had improved dietary diversity, less food insecurity, and the kids showed improved growth parameters. But you don't have to live in poverty to enjoy a home garden. It's fun, cost-effective, and a healthy way to increase veggie intake in homes across the globe. I'm Dr. Nerida McKibben, and that's today's health news. Today's expert guest is Dr. Steve Adams, a paediatric surgeon who looks after kids right from birth. One problem seen in babies is a hernia in the groin. I asked him how often this happens.
So inguinal hernias happen pretty commonly. In children, it's about 5 in 100 newborn babies.
Wow.
So reasonably common.
Yeah, that is common.
Much more common if you're born premature. About 1/3 of babies born premature will have a hernia.
That's a lot of hernias that you see then.
Yeah.
Yeah, especially working in a tertiary centre with
Absolutely.
lots and lots of preterms.
By far the most common operation I do.
And now, why do they form? What puts a preterm babe at risk?
So boys are much more at risk of a hernia than girls, by a factor of like 6 to 1. And it's all about testicular descent. And the testicle starts life up by the kidney. And it comes,
like the ovaries do?
Yeah, exactly the same. And it passes down the back of the tummy and through the inguinal canal, which is a muscle canal that leads down towards the scrotum. And the testis brings a little bit of the lining of the tummy with it, a little outpouching. And that's what the hernia is. It's the outpouching of the peritoneum, which is the tummy lining. And quite simply, that's meant to close, and it doesn't sometimes.
So it would close towards the end of in utero life, presumably.
Absolutely.
So if
Yeah,
that
the
gets
last
interrupted.
weeks.
Absolutely.
Okay. And so that's why a premature baby is much more likely to have a hernia, because actually they haven't gone through that process yet of the processus vaginalis, as it's called, closing.
And now, after they have been born prematurely, could it then still close?
Absolutely.
Yeah.
It can, and it very often will do without ever causing a problem. There's a shutter-like mechanism where the inside layers of the peritoneum kind of sit over the top of each other, and it's only really whenever they're stretched apart into a hole, if you like, that you actually see a hernia. Otherwise, it's just going to be a little bit of fluid that might trickle down, and in boys you call that a hydrocele. So we do need to tell the difference between hydroceles and hernias.
Right. So explain for parents what a hydrocele might look like, because that can be quite worrying.
They can,
for some dads,
they can look very
especially.
alarming. Yeah, absolutely. So a hydrocele is simply fluid, and it looks like it's sitting around the testicle, but it looks bluish, and that's simply because of the colour of the blood absorption as it goes past the layers of the skin and the fat and the muscle. And so it can be quite an alarmingly big swelling, but as long as it's just within the scrotum and doesn't go up into the groin region, then that's quite reassuring that it's not a hernia. I must say there are some experienced doctors that will struggle even to tell the difference. So if you're worried, you should see your doctor and they can tell. Most of the ways that we try and tell the difference are we'll squeeze on it and see if we can make it squish away with a gurgling sound, and that'll be a hernia. Whereas a hydrocele probably won't change at all whenever you squish it. And the baby will be happy and not be sad.
Right. And what happens to the hydrocele over time?
So hydrocele is usually that little channel that's connecting them up to the peritoneum. That closes by the age of 2 spontaneously, and it goes away. If it's still there at the age of 2, we recommend that you have an operation to close it.
So give it time to self-resolve and don't rush the surgery. More wisdom from Dr. Steve later in the show. Don't go away, because it's almost time for a yummy treat from Melinda.
Is the obesity epidemic real or a lot of hype? Data from the National Centre for Health Statistics shows that in the year 2000, almost 2/3 of the US population was overweight or obese. Increasing your physical activity is an effective way to lose weight. Swimming, tennis, gardening, and cycling are all good ways to be active. The epidemic is real. The good news is that you don't have to be a statistic. A physically active life is another ageless advantage.
Caramelized bananas are the best way to use those spotty bananas, you know, the ones that start to get a little bit spotty and no one wants to use them on their cereal anymore. So caramelized bananas today, we're going to do that, and they're really, really good with a lemon cashew cream, which I'll show you how to make in our blender. We might get the bananas started and then we'll head over to the cashew cream. So we're just going to peel these. It doesn't matter if they're a little bit spotty inside, even a little bit soft. They'll be sweeter and yummier. Bananas are super high in potassium, which is great for your muscles and your bones. You can see there, it doesn't matter if they're a little bit brown, no problem at all. We're going to put about a teaspoon of olive oil into our hot pan. And just roll it around a little bit, get it warm. And we're going to put those bananas straight in there. So this would serve sort of 4 to 8 people, depending on what the serving size is. It's a great recipe for if you just need a really, really fast dessert. You've got people around and they want something sweet at the end of the meal. You can just whip this up in no time at all. Okay, and while those are just heating in there, we're going to add some maple syrup. Around about 1/4 cup. We'll let that sizzle there for a while we make our lemon cream. The base for the lemon cream is tinned pears. So what you need to do is you need to, if you want it to use it straight away cold, if your pears have already been in the fridge, that's the best way to use them. Just drain them and then we put the pears in here. And to that we add some cashews, raw cashews. We add some vanilla. A little bit of guar gum. So these are a guar bean that's been ground up, so it sounds a bit strange, but it just adds smoothness and a little bit of thickening to our cream. We need to put in 1/2 cup of almond milk. And to make it lemony, we need the zest of a lemon. Believe it or not, there's a lot of sweetness in lemon zest. It makes a huge difference to this cream. You can have it without, but just that little bit of lemon zest makes all the difference in the world to the flavour. So we're going to blend that. Okay, back to our bananas. You can see that they're getting nice and caramelly in here. Just going to flip them over very gently because they're quite soft. I think as a mother you develop Teflon fingers when you're cooking a lot. And a little bit more maple syrup. Our bananas are looking beautiful and caramelized and nice and sticky, which is just what we want them to be. So we're going to turn them off, and they're beautiful and soft. Turn that heat off. And now what you'll need to need to worry about is we just need to serve them. There's a fly, there's a fly. And we'll just add a little bit of our lemon pear cream. And a bit more lemon. And that's it. Super easy. If you've already done your lemon pear cream ahead of time and it's sitting in the fridge, or you could see how quick it was to make the caramelized banana, we add a few chopped walnuts, a bit of protein and a little bit more fibre. Ready to go. So delicious and so simple.
Oh wow, I love bananas and that just looks divine. Wendy felt like she'd had a stroke in 1989, but it took 11 years to diagnose. In fact, it was multiple sclerosis, but she's not a quitter. Watch.
Once I was diagnosed, my husband, who was right into exercise, and that said, oh, well, we'll sort things out. We don't know how long you've got, so, make it. And we went into, I went to a naturopath. I didn't take any drugs or anything because there was nothing around. I wasn't that bad. It was my left side and that I was having weaknesses with, and balance, sort of very lucky that I didn't have it bad. And we tried acupuncture because he was into that, and then he decided I should swim and we read a book on Pilates, so Pilates was it. And I found that those two things were brilliant. Riding a bike was not the answer because my left side's my weakness and I always wanted to dismount that side, so it was always a disaster. And we went from there. So the exercise part of it helped enormously, and all the supplements that I was taking. And I don't think my diet wasn't good, but it wasn't overly bad either. And then we travelled a lot, and it was just, I got better and better because we were so active, and he made me do things like that. Because I didn't really swim before that. I couldn't swim, but by the time he finished with me, I was swimming pretty well. And then he had an accident and died, and I was left to carry on. But I had all those things in place, and it just went on from there. When we were going through COVID, I couldn't swim because they closed the pool, and I had to, so I decided I'd better walk because we can walk around the village and outside the village. That wasn't a problem. And I found that just the fact that you do things, you've got to keep going. And I was lucky enough that the Pilates teacher I've got did Zoom classes. So we had stretching classes and things like that. But I also found that walking wasn't good for my back, but it was good for me, but it wasn't good for my back. So when I found that swimming helps my back. So that's a good motivation to keep swimming because it was not nice. And I just find that swimming as much as I can helps me to just keep that. It's a good exercise all over, swimming. It's just been absolutely brilliant. Having a healthier diet and getting back into my exercise as it is amazing. It has changed. I've noticed the change, and I'm happy with what I'm doing, and I'll continue to do it. It's not something that I've suffered doing it to get to where I am. I'm enjoying it. So I think that is important. I think that it's a shame more people don't do it, but that's the way it is. You get the advertising for all the bad stuff, and not so much bad as convenient. You're not going to go to the trouble of doing anything. And of course, the older you get, the less trouble you want to go to. So it's not really good. But I'm enjoying it.
Way to go, Wendy. We're talking today with paediatric surgeon Dr. Steve Adams about newborn surgery and inguinal hernia in particular. I asked him how soon after birth they need to be surgically corrected.
So inguinal hernias just need treated routinely, mostly in children, but in babies they need fixed quite quickly because babies have about a 1 in 5 risk of something getting stuck in the hernia beyond where it should be. And so that's often the intestine in a boy, or sometimes the ovary in a girl. And you don't want something like that to get stuck because it could lose its blood supply and could make you quite sick.
So if it's bowel, then you'd have to take out that dead portion and rejoin it.
It's unusual to need to do that, happily, because actually most people will come to hospital in time.
Right. So tell us about the surgery for the fixing the hernia. What do you actually do, and how long does it take? So
it's a quick operation, certainly less than half an hour for the operation bit of it. And it depends a little bit on exactly the patient and exactly what type of hernia they've got. You may have a choice between a keyhole operation and an open operation. By far the commonest operation is a small cut in the groin where we just find the little sac that's going down to the scrotum. It's usually a boy, and we separate off the blood vessel and the sperm tube, the vas deferens, from that sac, and we tie off the sac and divide it. It's a really simple operation. It's called a herniotomy, and as I say, it doesn't take long. That's usually extremely effective.
And they're usually on both sides, or just the one side?
Usually it's just one side. Keyhole operation might demonstrate that there's a problem on both sides more commonly than you actually see a hernia. And so that's one of the reasons that I might choose to do a keyhole operation, is to look for a problem potentially on the other side and prevent it before it happens. There's still some controversies about that.
How quickly do these little ones recover from surgery?
Yeah, most of these operations are what we describe as day case surgery. So you come in and have the operation, go home the same day. And that means that they recover really quickly. Very small babies often need to stay in hospital for a night just to make sure their breathing's okay after an anaesthetic.
And do they need much pain relief?
Pamol, paracetamol for a day or two. It's not usually a super painful operation.
And how long before they're fully recovered? Or is it pretty quick?
2 or 3 days usually. Kids are amazing.
Explain why at birth a little boy is checked to see if the testicles have descended properly.
Sure. So if the testes aren't easy to feel in the scrotum whenever you're born, we do just want to make sure that they are going to descend. So you'd need a follow-on checkup. Usually it's 6 to 12 weeks to prove that the testes are both descended. Because if they're not there by that stage, they probably aren't going to descend, and you might need an operation to help that process.
So by 3 months, they should be down.
Absolutely.
And preterm babies, from what we've said before, presumably they're more at risk of this?
So we do wait that 3 months because the testes will probably descend still.
So you'd add 3 months to the time that they were actually due? Or no, 3 months from birth. Yeah. Okay. Yeah. So you want them down by then. So how common is this?
About 3 in 100 boys will have some degree of undescent of the testes, but by 3 months of age, only 1.5%. So not that common.
So only half will fix themselves by then? Yeah.
That's right.
Okay. You just don't know which half at the beginning.
Indeed.
What are there any other risk factors, or?
Not particularly, but one of the things that we do have to look out for is a problem on both sides. If both of the testes aren't down and you can't feel them, we do just want to make sure that the sex of the baby has been correctly ascertained. There are some rare problems where you have a difference of sex differentiation, and you want to make sure that that's not going to cause any other problems. So
would you usually do a check if both were undescended?
Yeah, if they're both undescended, they just need a specialist to check. Because actually most of the time whenever a child like that comes into my clinic, I can feel the testis. And that's by far the best outcome. And if I can't feel either testis, then I'm going to set off a chain of complex and difficult investigations.
Expensive ones.
Expensive and unpleasant for everybody. So we don't want to go down that path, and most of the time we don't have to.
Sounds good. More from Dr. Steve later in the show. I'll be back in a moment to answer your questions, so stand by.
Is it a big deal if you're a couch potato? Well, a recent study by the National Institutes of Health argues that physical inactivity and obesity are very big deals. Obesity and physical inactivity increase your risk of a lot of unpleasant things, specifically heart disease, type 2 diabetes, high blood pressure, and certain cancers. And these risks increase as we get older. So today, get up off the couch and enjoy some physical activity, which is another ageless advantage.
Now it's time for you to ask me some questions. Henry from Toronto asked, how can I get off my blood pressure tablets? Well, Henry, there are so many things that you can do to help slowly reduce your blood pressure naturally. It's not that you stop your meds and start making the changes. You need to actually transition, but it can happen quite quickly depending on how many changes you make at once. So be sure to check your blood pressure frequently and let your doctor know that you're doing this and that they need to monitor and help you titrate your meds. Set time aside to walk 45 to 60 minutes on 5 to 6 days of the week. That's 3 to 4 miles a day. Eliminate salt. Just don't put salt in your cooking, you just add it at the table if you need it. Eat well-cooked green leafy veggies every day, half a cup at least. Eliminate cheese and meat. Drink 8 glasses of water a day. Lose enough weight to get your body mass index to 25 or less, so that's down into the ideal range. Dress with your limbs and your body covered evenly. So in other words, don't put 1 layer on your arms and legs and 4 layers on your body, but preferably say 2 all over. Eat 5 to 10 servings of fruit and veggies every day. Avoid processed foods, for example, white grains, sugar, pasta, rice, and things in crinkly bags. You just want to avoid them. So eat home cooked and simple as much as possible. And then if you're still not winning, beetroot juice, maybe 1/4 cup twice a day, or you can even get beetroot powder. You'll take 1 to 2 tablespoons of beetroot powder and a little water, very tasty, and that will help to vasodilate your blood vessels. Someone asked, what are the symptoms of colon cancer? Well, symptoms include persistent abdominal discomfort like cramps, gas or pain, and it can happen anywhere in your tummy. Usually there's a change in bowel habits, there may be blood in the stool, or a feeling that your bowel doesn't empty completely. You may have fatigue, weakness, and unexplained weight loss. Margaret asks, I'm 84 and I've endeavoured to be healthy all my life. I mostly walk 1.5 miles every day. Is that okay? How much exercise is best? Well, Margaret, keep it up. That is awesome for your age. Now, the more you maintain your activity, the better, the more independent you can be. Now, the guidelines on exercise are for everybody. They're based on healthy outcomes, and they recommend 150 minutes of moderate exercise a week, plus 20 minutes of strength training twice a week. So if you're exercising every day, you'd be looking at 22 minutes a day. That would be adequate. Older folk can't walk as far as younger folk, and that's why it's set on minutes per day, because you put just as much effort in, though you don't walk as far. So I suspect your 1.5 miles would be perfect for you. You might want to add in, though, that strength training, the 2 strength training sessions by lifting a few weights, working on balance exercises, and be sure that they're functional exercises that are going to help you maintain your independence. Thanks for those questions. If you have a question, send it in using the contact details on the screen. Now, let's head out and look at the fruit and veggie stand. Pears are classified based on their origin as either Asian or European pears. Asian varieties are crispy and firm, and their consistency doesn't change after harvesting or storage, so it seems they're always ready to eat. Each pear contains a whopping 5 grams of fibre, which we know to be protective against colon cancer. They're a good source of minerals too, with copper, iron, potassium, manganese and magnesium. They contain plenty of antioxidants too, and are the least allergic of all fruit. Because of their mild anti-inflammatory action, they've been used to treat colitis, gallbladder, arthritis and gout by traditional healers. Apart from eating them raw, a great way to eat pears is to blend them with a small handful of raw cashews and turn them into pear cream. Bon appetit. And Melinda's pear cream took it up a notch. Today's guest is Dr. Steve Adams, and we're discussing surgery for boys whose testes do not come down into the scrotum. I asked Dr. Adams if the risk is higher in baby boys whose parents use alcohol, smoke, or have pesticide exposure.
We think so. The studies aren't amazingly good on this topic, but you're right, those things have all been identified as possible links, not necessarily causes, to something called undervirilization. So perhaps a reduced amount of testosterone in the system than you would otherwise expect. And you get other undervirilization problems too in some of those children, like hypospadias, which is when the hole in the penis isn't quite the right place. So those things can be linked together, and we certainly have seen an increase in certain areas at certain times and some of these problems. But again, really hard to prove exactly what the cause is.
Mm-hmm. So what does surgery involve for undescended testes, if in that 1.5% of kids that need?
So first of all, I think we need to talk about when we do the surgery, because we don't do it at the 3 months or even usually at the 6 months. Normally, we'll try and get nearer to 9 to 12 months before we do this operation. Ideally, we'll have testes in the scrotum by a year of age. But there's some risks to doing operations, including giving a general anaesthetic. And so those risks reduce over that first year of life. So we try and push it out to reduce that risk as much as we can. The operation itself is simply a cut in the groin, and usually a small cut in the scrotum, where we work to bring the testis away from, again, that processus vaginalis that we talked about with hernias. That's almost always there in a undescended testis, and we can separate that off, get rid of it, and that almost always gives us enough length to get the testis down to the right place.
What happens if the undescended testis is not recognised and that person grows up?
Yeah, so it's really relevant because we are acutely aware of the fact that there are some cancers that are much more likely in a testis when it's undescended, particularly if it's there undescended after puberty. So I think the safest answer is if we can't get it down to the scrotum and we're worried about it, it would be taken out. So it's much better to have a testis brought down to the scrotum early than it is to leave it. And people do worry about anaesthetics and that sort of stuff and operating on young children, but there's very good reasons to want to operate on children when they're younger for this particular problem.
What about in the situation where you mentioned not being able to feel the testis?
Yeah, so if a testis can't be felt even by a specialist, then it may be that the testis has actually already been reabsorbed by the body or never formed, or perhaps it's up inside the tummy. And very often people want to do scans and tests to look for that, but actually I'm afraid our scans and tests aren't really good enough most of the time to tell us where a testis is. And so we often suggest doing an operation to look inside the tummy with a keyhole camera. And then if we do find a testis in the tummy, we look at it and work out if we can bring it down. And usually we worry that actually it's not going to stretch, the blood supply is just too short. And we do a clever operation called a Fowler-Stevens operation, which is where you remove the normal blood supply to the testicle, you leave it for a few months, let it develop its other blood supplies, because it's got several, and then bring it down to the scrotum on that blood supply. And that works pretty well.
Wow. How long does that take between the two procedures?
So about 6 months routinely.
That quick?
Yeah.
Amazing.
Yeah, you can do it all in one operation, but I think it's probably better to leave it between the two.
There's a surgical procedure for baby boys that's been around for a very long time. In the Old Testament, circumcision was a religious rite that was required of every male Jewish child on the 8th day after birth. In itself, the surgical procedure didn't gain them any heavenly favours. It was meant to signify externally that they'd been set apart to God, and the plan was for every Jewish child to grow into a saving relationship with God, to undergo circumcision of their heart. God's word is described as being sharper than any two-edged sword, and it pierces the heart. We have all experienced the pain of conviction when we feel that our heart has been cut to the core by the realization of our true condition. If we allow it, God's word can bring us under deep conviction. It will remove our pride, our rebellion against the Holy Spirit, and our refusal to repent. It brings a desperate desire for the grace of God to do a deep work in our hearts. It will cut away the dross and refine and renew us. Physical circumcision was done away with in the New Testament, but the spiritual lessons still apply today.
Are you considering learning a new sport? It could be a huge advantage. Recent research found that men who improve their physical fitness reduced their chance of death by 44%. Middle-aged and older men who began a moderately vigorous sports activity like cycling, soccer, basketball, or hiking lived longer. They also had lower rates of death from heart disease. It is time to get off the bench. Taking up a new sport is another ageless advantage.
We're talking today with paediatric surgeon Dr. Steve Adams. I asked him what problems there might be with the foreskin in newborn baby boys.
Yeah, so tight foreskin is a really common problem. People worry about it a lot. And if you have problems with urinary infections or infections in the foreskin, then that's really relevant because actually there are lots of bugs that can grow underneath the foreskin. And if you can't pull it back to wash it, then it's possibly better to remove it. Having said that, that's probably about the only reason to remove a foreskin these days. There's lots of people ask for kind of cultural or religious reasons, and that's fine, but it's not something that our health system usually funds, and not something that I tend to do in my practice. The foreskin does have a purpose, and it's got about 1 million nerve endings in it. So it's probably there for kind of sexual purposes mostly, and removing it is probably not a reasonable thing to do if there's no good reason to do so. And there's certainly been some litigation and so forth around the world looking into that, where people have been found at fault for removing a foreskin for simply cultural reasons at the request of the parents. So I'm a bit cautious about doing operations on parental request, because actually the child has rights. Removing a foreskin is usually not necessary, even when it's a bit tight, because actually you might need to apply some steroid to it to make it a little bit stretchier. And simply pulling it back, having applied some steroid, might be enough to sort out the problems.
And how long before you start applying steroids to when you might be able to?
Yeah, so I don't tend to apply steroids as a treatment until you're 6 or 7 years of age, because by then what we describe as the endogenous steroids, the steroids that the child produces themselves, are starting to come up anyway, and your steroid therapy is more likely to be successful for the longer term, as opposed to having an effect and then simply going away whenever you stop doing it.
And kids under that age are not likely to get infections?
It's unusual.
Yeah.
It does happen. And if it does happen, then you do need to see a specialist to talk about that. Depending where you are in the world, depends on what advice you'll be given about foreskins, whether you should pull them back or not to wash. And in certain countries, the midwife will explain to the mum and little boy that the foreskin has to be pulled back to be washed every day. In other countries, we'll say leave it alone. I'm afraid I'm in the leave it alone category at the moment.
We've talked about little boys. Let's talk about little girls. What about little girls when they have labial fusion problems? It's just similar to the problem that you have with the tight foreskin.
Absolutely. So labial fusions when the inner labia, the labia minora, are fused together, and it's quite a frequent thing that we see. Most of the time, it doesn't actually cause any problems. And the only things that we really need to make sure are that it is a little girl, that there's no actual chromosomal problems there. And we can do that usually just by examining and looking and making sure that everything looks normal. And then the other thing is to make sure there's no infections, urinary infection. And if it does, then we don't need to do anything about it. If there's problems with urinary infection, then we might have to look at separating the labia from each other. And basically, if there's either of those things, if we're not sure that the genitalia look totally normal, or if there's urinary infections, we might apply an estrogen cream for a few weeks and see if the adhesions will separate, and then re-examine and have a look and make sure that's normal.
Why do they form?
I'm not totally certain we really know, actually, but it's hormonally sensitive tissue.
Right. I was going to say if hormones separate it, maybe it's...
Yeah, it's just like what I would describe as prepucial adhesion. So the head of the penis can be is normally stuck to the foreskin when you're born. I think it's very similar. And no, we don't see it very often because actually babies get a little bite of estrogen into their bloodstream as they're born.
So what age would you be looking at separating labial adhesions? How long would you give it?
Generally, they don't need separations at all.
Yeah.
If they're symptomatic, then I treat them whenever they've got the symptoms.
So that might be several months of age.
Absolutely.
Or even at birth?
Yeah, absolutely. Either of those things are true.
Okay.
Normally, the children come to my clinic when they're a few months old and maybe parents are noticing that the urine's spraying everywhere, that sort of thing.
Now back to Wendy, who had neurological symptoms for more than a decade before being diagnosed with multiple sclerosis. Her husband was into exercise and her naturopath encouraged it. She enjoyed Pilates and swimming, but then her husband died in an accident and she was left to carry on alone. Watch.
I had been to a health retreat once before and I thought it'd be nice to go to one, and found it online and went to it. I had no idea what I was going to get there, and found that it was really good. I went on my own the first time and thought, oh, this is too good. So I took a niece the second time, and the third time I took my daughter and my niece. And they got a lot of benefit from them. My niece at the time when I did take her, she was going through emotional problems and she found it was absolutely brilliant. So they treat everything about you and really put you on a good path. They do an exercise every day, and I learned a lot with that and found that what I was doing, mainly what I was doing was good for me, so that sort of brought home to me that keep going with what you're doing. And every other day you did cooking lessons, so they're actually showing you and you're actually doing it, so you understand it a lot more, because doing vegetarian stuff is a little bit different to ordinary cooking, and it was just amazing what you could do and how tasty it is. And so I just kept with it because of that, because it was great. I've lost the weight I wanted to lose, and maintaining it. That's, I think, what the problem with just diets, that they don't really teach you to maintain. And in this way, I'm just doing it. I don't deliberately not eat meat, but I'm not interested in eating it. And I haven't had a lot of sweet stuff, so because I'm eating enough, getting enough out of this vegetarian diet. With my diet now, I think what changed mostly is cutting out or having 3 meals a day and changing around what you have when you have it. Like, I have a try, it doesn't always work, have the bigger meal in the middle of the day and have something lighter at dinner time. And that does help, and not eating in between meals. It's mainly doing that sort of thing and just having 3 meals a day and just eating better food at the time. It has helped me a lot too, because carrying a little bit less weight, it helps with activities. And yes, it's just living life.
Well done, Wendy. What a great attitude. And as you've seen on Go Healthy for Good before, we have several stories of people doing really well by cutting saturated fats or going plant-based to reverse MS or multiple sclerosis. And parents of young ones, I hope Dr. Adams has been able to answer your questions on common surgical ailments in little people. That's all from me today. Thanks for joining us on Go Healthy for Good. I'll see you next time.